Botox is not just for the over 40 set anymore, apparently. A rising number of teens across the country are having cosmetic surgery procedures, including Botox injections, cheek implants, and liposuction. This morning, we hear from some doctors who perform these procedures on teens. Plastic surgeons around the nation have seen firsthand the recent rise in teenage plastic surgery, as well as the possible reasons why.
In 1992, the incidence of teenagers having plastic surgery were probably around 30 teenagers per day having plastic surgery. Now, believe it or not, it's almost 200 teenagers per day having a surgical cosmetic procedure.
Well, I think the increase in visibility on television, the access to the internet, a lot of other areas of the media, all the videos that teenagers have access to now, provides a new knowledge base that allows them to find out about things that they never knew about before. And in one sense, it creates a lot more education for a person. It gives them more information to base a good logical decision upon. In another sense, it gives them more information to chase something that they shouldn't be after.
I think that the standards of beauty have really changed from, let's say, the 50s until now. Miss America in the 50s was 5'7" and weighed 150 pounds, whereas last year it was 5'9", weighed 117 pounds. All this tends to influence the child who is growing up and who all of a sudden is faced with the reality that appearance does matter in our society. I think that being a teenage girl is almost like being a walking Miss America contest almost every day.
And what they found is that teenagers are usually looking for very adult procedures.
For instance, you know, we've seen some actresses with really big lips, and on them they look very pretty. But on a particular individual that comes in, bigger lips might look a little funny. So part of my job is not just to do the surgery or do the treatment, it's to tell them they don't need it. Sometimes they don't want to hear it.
But as with adults, surgeons won't do any procedure without first meeting strict criteria.
The main thing is that, first of all, that the patient themselves initiates the request. In other words, that the parent isn't the one that's wanting his or her child to have cosmetic surgery.
Whatever it is they're concerned about, when you look at them, is there really a problem, or is their perception of themselves not realistic?
Obviously, if there isn't a problem, then there isn't anything to do.
Surgeons can only do so much, and there's a line we can't go across. There are things that we cannot accomplish, so we need to make sure they're realistic in regards to what we can accomplish surgically.
And the final thing is that they be psychologically stable and fit, that there isn't any problem with eating disorders, there isn't any problem with bulimia, with overly anxious, depressed individuals, because obviously not only would they have a difficult time with the cosmetic surgery, but it probably won't affect what they want it to affect, and it may actually make it worse in their life.
Do they have the ability to accept the change that they're wanting? Will they be happy with the change 10 years from now? Because this is not like changing your hairstyle.
But often these young patients are looking for something other than what a plastic surgeon can give them.
Their feelings that everything depends upon their appearance is true in most cases. Unfortunately, our society definitely places too much emphasis on appearance, but it's neither for me to say or change.
If a patient comes in and they're trying to be somebody else, that's a real key to say that they're unrealistic. And those are the type of patients that are going to be happy, because they're never going to be a Britney Spears. They're never going to be some of these other stars that are out there. I want to avoid the patient that's got this image of some movie star in their head that they're trying to emulate. That's the kind of patient we don't want to operate on. They don't need me. They need something else.
Dr. Howard Sobel is a dermatologic surgeon and director of the Skin and Spa Cosmetic Surgery Center here in New York City. Dr. Sobel, good morning.
Good morning.
You know, hearing about all these teens wanting things like Botox, cheek implants, liposuction, sometimes wanting fat to put in their bottoms so they'll look more like J-Lo, to me it is so tragic. Do you have a lot of teenagers coming in saying they want these procedures?
You know, not compared to the amount of adults, of course. You know, when you heard the increases of plastic surgery, cosmetic surgery, the increases are on the rise whether you're an adult or a teenager. So if you really look at the numbers, the vast numbers of teenagers having plastic surgery is not that high.
You specialize in lipo.
I specialize in liposuction.
If a teenager comes in and says, Dr. Sobel, I just don't like my body, I think my thighs are too fat, can I have lipo? What do you do?
First, you make sure the person, they're doing it for the right reasons. We first always will interview the parent first, and then we'll see the teenager, and then we'll bring them in together. because you have to be very careful. A lot of times the parent wants the child to look like them, and very often the parent doesn't look like the child at all because they've had so much surgery done. They can be a cosmetic junkie. So you got to make sure that the child is doing it for the right reason. And if you're going to call them a child and they're truly a child, you're not going to do the surgery. Now, most surgeries, most teenagers walk into my office, we do not do liposuction. So I don't want it to be, you know, for the audience out there to think, gee, teenagers are just getting liposuction.
Because I would think that the first thing you would want, obviously, as some of the doctors pointed out, these teens need help on the inside, not the outside. And also, if they're having problems with their bodies or feeling overweight, they probably see this sometimes, you can't obviously generalize, as a quick fix. Do you ever say you need to exercise and watch what you eat? Liposuction should be an option of last resort?
100%. Okay, what liposuction is not a weight loss program. Okay, what you're doing, basically, you're putting them on an exercise program. You're giving them a nutritionist. Okay, but then what you also want to do is look at the parent and see what they look like. Okay, genetically, okay, you go on a diet, you get to optimal weight, you could actually look gaunt in your face, and you still have that so-called violin shape. So the girls won't want to wear a skirt. They won't want to wear tight pants or jeans. So sometimes there's a problem there.
We have some graphics of people, children, I guess, teenagers, 17-year-old and 16-year-old girl. Real quickly, let's go through this and tell me why this was a candidate for liposuction.
This is a fellow that got down.
That looks fine to me.
He got down to his optimal weight, and what he wanted to do, he couldn't get that V shape. When he wore his jeans or a tight shirt, it hung over the back.
But hardly, it doesn't even look, Dr. Sobel, like he has a lot of fat there.
He was down to his optimal weight, just couldn't get rid of that. Now, is that absolutely necessary? No. But it made him happy. We did it under local anesthesia, very little risk.
And there's a leg.
Now, here's a case that I think changed this girl's life to a large extent. She was 19 years old, never wore short skirts, had this foot that was sort of shaped like, almost like a club. Straight. Okay, now look, we did her ankles, we did her calves, and we did her knees, and you can see the difference.
Right. Well, Dr. Sobel, thanks for coming in. We appreciate your time. And we'll be back after your local news.